Hi, friends. I'd like to share with you today a quick little self-care exercise for the knees. So let's start with one knee. You could do this in a chair, but you also want your knee to be slightly extended. And if you're doing it on the floor, you may want to have a little bit of a towel or a blanket underneath you to support that knee a little bit. So we're going to work with the patella, which is the kneecap, taking it in a range of movement, going down towards the toes and up towards your hip. I'm just using my finger to gently glide the kneecap up and down. And notice where in that range you feel it glides the easiest. So whichever range is easier to go to, and it should be more comfortable, we're going to take the kneecap in that direction, kind of exaggerate where it likes to go. Hold it there, and then with your thumb or forefinger, come to the middle of the kneecap and push it straight down. And we're simply going to listen and wait. You could count to about 10 or 12, or you could listen for the movement or a shift at the knee joint, and then gently let that release, and maybe recheck your range of movement, going down towards your toes and up towards your hip. Notice if anything has changed with that. Maybe there's a little bit more ease, maybe the range of movement has shifted a little. And then let's do the same thing coming left and right, going medial and lateral, gently moving that kneecap, gliding it one direction and then the other. Notice in that range where it likes to go, which direction is most comfortable, and then take it further in that direction. Bring your thumb or your forefinger to the top of that kneecap and give it a gentle push down. And the pressure is really up to you. The least amount of pressure is the best. However, we want to feel like the sensory nervous system, those nerves are listening. And there's the response. And then recheck that left and right direction. And then let's take it like a little doorknob, counterclockwise and clockwise, and notice your preference. And you might say, I don't notice either of those. They both feel weird. And that's okay. You can pick one. Or maybe you notice a different direction, like, oh, I noticed that mine wants to twist a little bit and glide diagonally and then do a little bit of a shift down on one side. You could also do a combination. So if you have a preference on the twist, take it into that twist. Use your opposite hand to bring your finger down right on the middle of the kneecap to push straight down. See if you can notice the back of your knee at the same time while you're doing this. Or maybe you notice your lower leg and your foot, or the movement traveling up your leg into your pelvis. And then gently release and recheck. Notice if the glide is any different. You can do this exercise a couple times a day if you'd like, but I wouldn't do it more than that in terms of how long you're with the kneecap in one setting. So then I'd like to do one last one, which is a femur override. Sometimes this femur gets a little bit ahead of or anterior to the tibia, which those two bones make up the knee joint. So I'm going to slide my hand underneath my femur and lift it up a little bit. I might use my blanket to help assist me. And then the other hand goes on top of the shin or the the tibia, and we're going to press straight down. So I'm doing this a little bit with my hands, bringing the femur up, exaggerating that override, and the tibia down. Again, only do this if it's comfortable. If it's not comfortable, it may not be the move for your knee. Listening, waiting. If you don't feel anything happening within about 20 seconds, then simply release that hold. Oftentimes you'll feel a little bit of a rebound or a little bit of a release or a reflexive movement that your knee, your leg wants to come out of. So then after that, I urge you to get up and walk around and check out your new knee. and see and feel the difference if you changed anything from one side to the other. And then I would absolutely repeat the same thing on the other knee. I hope you enjoy that, and I hope your knees feel the love that you're giving them. Thanks, everybody.